Good evening. How are you? Wish you are fine. I'm Dr. Bassem Sulaiman, a plastic surgeon. I already spoke before about buccal fat removal. I think you have heard about V-shape program by means of buccal fat removal. Why is a slim face more admired than chubby ones? Because slim or V-shaped face makes women look sexy and fierce, which gives them more confidence with daily undertakings, achieving of it with the right attitude. Change your lifestyle from inside through outside. Change your lifestyle from inside through outside. So the buccal fat pad, also called as Vshape fat pad, after the French anatomist Marie-François Xavier Bichat, is part of the many fat pads of the face. The buccal fat pad glides in a plane between mastication muscles. Its anatomy describes a central body and four extensions: buccal, pterygoid, deep temporal, and superficial temporal. The buccal portion is the most superficial and thus the only portion that is removed. The bichectomy or buccal fat pad removal is a minimal invasive procedure that usually takes place in a doctor's office. Doesn't take longer than 20 minutes. Removing this fat pad strategically gives a shaper, chiseled, and more symmetric appearance. Good candidates are patients that, despite losing weight or are in their normal weight, the volume in their cheeks area is still prominent. The procedure is highly bearable with local anesthesia, which is injected inside the mouth at the level of the second upper molar. At this site, a small puncture incision is made and it's carefully dissected so that no neighboring structures, nerves, or vessels are damaged until the pad is found. Once the pad is found, it is pulled to the oral cavity to remove it under direct vision, thus not harming any other structures. The incision heals by itself or closes by the 4th to 5th day, and no sutures are needed. Factors that influence results are amount of buccal fat pad removal. Average amount is 3 centimeters, the size of a chestnut, healing process, wound retraction, overall tissue, amount of facial muscle and skin. The result starts to show after the swelling begins to fade away, usually at 1 month post-op, and the end results at 3 months post-operation. You should search for a good doctor in order to have a good result, of course. The most common complications, although rare, is hematoma that is related to effort in the immediate 3rd day post-op. Hematoma is a self-limiting complication that, besides the size of the swelling, it always resolves. Takes 1 week to get better. Other complications are infection, facial nerve damage, and salivary gland duct or stenon duct. People in general, people undergo buccal fat pad removal procedure so that they may have a thinner looking face, and so that their cheekbones may be more defined. They also want to enhance their appearance more, resulting in a higher confidence level. Here are some of the important considerations that you should keep in mind if you want to undergo buccal fat removal. Like in any medical procedure, buccal fat removal requires you to have your medical history cleared up, tell your doctor everything, and not keep any secrets. This would make sure that you will have a smooth buccal fat removal that will definitely give you all of its benefits. You will be injected with a local anesthesia when you undergo buccal fat removal. When all of the fat is removed, the surgeon closes up the incision made. It may be, as we mentioned, if there is only puncture when you make an incision that is like the puncture or 2 millimeter, no need to close it in general. But if it is half centimeter, you should close it by chromic in general. When all of the fat is removed, the surgeon closes up the incision made. There will be a significant amount of pain that can be managed with pain medications, painkiller. You should rest at home for at least a week, and you should lessen strenuous activities a few weeks after your bed rest. I prefer in general to rest after any operation for at least 2 to 3 days. So if you are longing for a slim, sexy cheeks, make your dream come true. A lot of surgeons may make it happen for you, and one of the most things is buccal fat removal, which is a minor plastic surgery that takes at least only 30 to 40 minutes with local anesthesia, outpatient, and recovery period takes only 5 to 7 days. No visible incisions and scars on the face, resulting in a natural appearance. Your friends will be amazed to see you glow without knowing you did surgery. Safe, incredible, and natural result. In general, we spoke about the buccal fat removal and how to make the V shape of it. It makes the face slim and admired more than the chubby cheeks, because as I told you before, that it helps you to feel confidence, which is the most important thing. In addition to the buccal fat removal, you may need, we have measurements of the dimensions of the face. You may need to have liposuction of the double chin if you have it, and you may need to have prothèse for the chin or filler for the chin. By this way, making the or extraction of the fat pad, Vshape fat pad, and the liposuction if you have it, and a lot of ways to get rid of the double chin and have more defined chin. You will have the V shape. This is what we were talking about. We have finished this video. It is related to the buccal fat removal, which I spoke about it before. Wish that you like this video. Please like, go and make like, share with your friends, and subscribe to my channel. Sorry, and activate the bell. Okay, thank you very much.